After that, apply medicinal ointment so that the proliferation of bacteria could not take place. Use enough ointment so that it does not stick to the abrasion. Use a big piece of gauze for dressing. Then visit the doctor for proper dressing and tetanus injection, which is required to prevent the wound from causing an infection. The dressing should be changed as per the instruction of the doctor. Contusion. Contusion is a muscle injury. A direct hit with or without any sport equipment can be the main cause of contusion. Contusion can be due to minor accident to the skin, such as falling, bumping into something, or being hit or kicked. Contusion is common in boxing, wrestling, and kabaddi. In contusion, blood vessels in the muscle are broken and sometimes bleeding may occur in the muscle which causes bruise. The raised area of the contusion is the result of blood and fluid from the injured blood vessel into the tissue. Stiffness and swelling are common features at the site of contusion. Sometimes in such cases, muscle fail to respond. In severe cases, muscle becomes completely inactive. Management of contusion. Cold compression should be used immediately. Ice or cold water should not be used for more than 40 minutes persistently. The cold compression should be performed 5 to 6 times daily. If there is more swelling at the site of contusion, the anti-inflammatory medicines should be given. If the swelling still persists, consult the doctor immediately. For the purpose of rehabilitation, the flexibility exercise should be performed carefully. Laceration. Laceration is an irregular cut in the skin from the sharp object or sharp-edged or sport equipment. These wounds are more dangerous than incised wounds. Such wounds are not smooth. Bleeding occurs in less quantity in such wounds. These wounds may be very poisonous. Usually rough marks remain even after treatment. Management of laceration. First of all, you should control bleeding before anything else. To stop bleeding, but pressure directly on the laceration while holding it above the level of the heart for 15 minutes. If you are unable to stop bleeding, try to use pressure points. Once bleeding has stopped, wash the laceration with warm water and mild soap. If bleeding starts again, repeat the step 1. That is, first of all, you should control bleeding before anything else. Stop the bleeding, but to stop bleeding, put pressure directly on the laceration while holding it above the level of heart for 15 minutes. If you are unable to stop bleeding, try to use pressure points. Now, third one, determine if the laceration requires stitches. If the affected person requires stitches, go to the doctor. For simple laceration which does not require stitch, use antiseptic ointment. Cover the laceration with sterile gauze and wrap the roller gauze. Clean the laceration whenever you change the